Then last is a pudendal canal. Okay, so this pudendal canal is an elongated facial canal located along the lateral wall of the ischiorectal fossa. Last time we have seen the ischiorectal fossa in last session. Okay, so this pudendal canal is an elongated facial canal located along the lateral wall of the ischiorectal fossa. It is formed by the separation of the fascia lunata medially from the obturator fascia laterally. It extends from the lesser sciatic foramina to the anterior end of the ischiorectal fossa. It contains the pudendal node, that is S2, S3, S4, which divides the canal into its it gets divided into its terminal branches. Okay, then you have got a dorsal nerve of penis and or clitoris, then perineal nerve and internal pudendal vessels. So pudendal nerve, pudendal vessels, along with dorsal nerve of the penis and perineal nerve. So these are the contents of the pudendal canal. Okay, inferior rectal nerve and vessels, that is the branches of the pudendal nerve and internal pudendal vessels, arise in the pudendal canal and pierce the fascia lunata to reach the anal canal. Okay, so you have got this pudendal canal. Okay, so this pudendal nerve and vessels will give this inferior rectal artery and nerve, and they will pierce this fascia lunata and they will reach the anal canal. Okay, so that is what is the pudendal canal. Most of the time pudendal nerves and vessel, they are always asked. Okay, so what is the significance? The pudendal nerve block. Okay, so pudendal nerve can be blocked in the pudendal canal by injecting local anesthetic agent via the perineal route. The needle is inserted along the medial side of the ischial tuberosity and anesthetic solution is injected in the canal about 2.5 centimeter from the surface. Injecting local anesthetic agent where it crosses the ischial spine. Ischial spine is palpated through the vagina and the needle is inserted through the vaginal wall and guided by the finger to the ischial spine. Herniation of the pelvic viscera into the ischiorectal fossa may occur if there is a gap due to the separation of the levator and eye muscle from the obturator fascia. This gap is called as hiatus of Schwalbe. Okay, so that finishes the today's topic of the anterior abdominal wall and few topics from the pelvis also, especially the nerves and vessels. Okay.